21 states are having increasing number of infections. 14 states had their highest 7-day average of new cases last week. On June 10th, the United States had over 25,000 new cases, the highest number since May 21st. And on that same day, California had over 4,300 new cases, the most since the start of the pandemic. And Texas had over 4,100 new cases, twice more than the previous daily high. Reports from several states indicate that they are not attributing the rise only to the increased testing or the protests. Due to the increasing availability of tests, though, experts are recommending looking at two other metrics to assess whether the pandemic is worsening. One is the percent of positive tests, not just the absolute number. And the other is the number of hospitalizations for COVID. We know that the number of hospitalized patients for COVID has been increasing in the following states: Texas, North and South Carolina, California, Oregon, Arkansas, Mississippi, Utah, and Arizona. In Arizona, the report is that already 76% of the ICU beds are occupied. All of this suggests that there is certainly, at least in some states, a rising problem with the pandemic and possibly with the capacity of the state to handle the increasing number. A modeling paper just published this week showed that the widespread use of face masks can reduce the transmission rate, or the RE number, to below 1, which is a critical criterion for slowing down the epidemic. Concern, I think we all know that older adults are at higher risk of infection and deaths because actually both older age and other chronic health problems, which are actually more prevalent as people get older, are independent risk factors. One study a couple of months ago showed that the case fatality rate in the United States was less than 1% for those younger than age 54, but 3 to 11% for those age 65 to 84, and 10 to 27% for those older than 85. Public health approaches like social distancing leads to isolation, which is more toxic for older adults who may need help with food, activity of daily living, as well as getting more elevated risk for mental health and cognitive problems associated with loneliness. I'll finish with nursing homes. It's been really the epicenter of the pandemic. Over 210,000 cases and 43,000 deaths have occurred in nursing homes or other long-term care facilities. As of May 28th, 26 states had at least 50% of their COVID deaths occurring in long-term care facilities. One study up until mid-May of over 9,000 nursing homes found that a third of the nursing homes had at least one COVID infection. And the factor associated with having a COVID infection were larger facility size, urban location, a greater percentage of African American residents, and not being a part of a chain. I'll finish by saying that despite having months of warnings and infections, 1/5 of nursing homes still report they have less than 1 week of personal protective equipment or PPE left. Part of this has been attributed to delays in the delivery of the PPEs promised by the US Department of Health and Human Services and